Yes, sir. You can see my screen.
Yeah. I can see that.
Sir, you can start now.
Uh, because slides, I can't, I have to tell you to next.
Yes, sir.
Okay. So can I start?
Yes, sir. You can start.
So there will not be any introduction or something. I myself introduce.
Yes, sir. You have to introduce yourself.
Okay, from your side, you don't do all those things.
No, sir. Now, Mishra sir is not there, no, sir. Available.
Okay, fine. A very good afternoon to each one of you participants. I'm actually connecting to you from National Institute for Mental Health and Neurosciences, an institute of national importance under Ministry of Health and Family Welfare, Government of India, Bangalore. A warm welcome to each one of you for this session on CBR and emergencies in psychosocial care. I'm sure actually that you have been actually having a very enriching sessions in the past week, month and weeks. So today I'm going to actually, I'm not here to teach you. I'm going to share some of the important aspects of psychosocial care in CBR and disasters. Myself, Dr. Jaykumar, you can see my screen. I represent a very specialized department, one of its kind in India, which is actually a full time. We work in emergencies and disasters, both human made hazards, induced hazards, or natural hazards, disasters, which we call it broadly. And I have over 24 years of experience in this area of work, providing care and services, designing various interventions, capacity building training for various populations, right from the bureaucrats to the executives to the grassroots levels to the technical people to everyone, whoever is working in this area of disasters and emergencies. And also, one of my area of interest is also working with first responders, something like NDRF, SDRF, state police forces, paramilitary forces, and all those people. And we also actually work on policy plans and programs. So for ministry, Government of India demands is the nodal agency for providing psychosocial care. So with this background, I also worked with National Disaster Management Authority for around 8 years in Delhi. Presently, I am a faculty as an additional professor in this department. Next. So next 40 minutes or 45 minutes, I'll be talking to you about these aspects. What is this CBR and emergencies in context to psychosocial care? Because you have already actually seen a lot of CBR and aspects. So what are all the reactions? How people get impacted in these sort of events or emergencies? And what is that actually on psychosocial front? How these stressors can affect an individual, a family, a community? What is that actually? All those things. And roughly here, actually, although there is a mentioning of chemical, biological, radiological, we are going to see actually that how this is all interrelated and how each disasters actually can pose difficult challenges for not only for those people who encounter it or experience it or getting affected by it, also people like us actually who respond to these sort of an emergencies, how they actually can actually handle this and what is the way forward for it. Next. So understanding a disasters, so emergencies, you have been hearing about this disasters, emergencies over a period of a time in your previous classes. So, what is that actually on the health front? Because psychosocial care is an health aspect, and health is very important for all of us. And there is no health without mental health. That is what WHO is talking about it. And if you go back to little back, I mean, a little go back to past days, there has been actually a number of efforts which is going on at the global level, state level, national level, local level, and everywhere. It was mentioned way back in 1979 that this is health is just not merely an absence of a disease or illness or infirmity, but also actually the psychosocial aspects. The the one needs to be actually healthy on psychological front, emotional front. That is why actually that is what we should be calling a proper healthy person or healthy individual. So it has been actually mentioned everywhere, defined everywhere. So what is that actually happens in a disasters on a mental health front, on a psychological front? So WHO defines even a disaster or an emergency, a severe disruption in ecological and psychosocial, which is greatly exceeds the coping capacity of the affected community. So it is just not about disruption in the structural aspects or an environmental aspects. It is also actually emotional aspects, which mostly actually that in a, events like a disaster and emergencies, it goes beyond our capacity to withstand, face it. So that is where actually that it is called disasters. So roughly there are two type of disasters, and today we don't call natural disasters because this terminologies are some people use it, some people don't use it. But for the sake of understanding, we use it for a general purpose. But natural hazards also we call it. So which is due to nature's fury, like tsunami, like earthquake, like floods, like cyclone, which you all must have been actually some form actually must have experienced it. So these are all natural hazards or natural disasters, which is actually beyond anybody's actually control. Some things actually we can predict, some things we can actually foresee it, forecast it, but we can't predict. I mean, we can't control it. Actually, that is where actually that we call it natural disaster or natural hazard. So what is that actually? Human-made disasters. This is actually essentially which happens due to a particular intention of certain groups, like riots, like war, which is going on all around the world today. This is all actually one group is targeting another group with the intention to create horror and terror, to create an insecurity, to actually take revenge. So these are all actually some of the human intentions are involved. And also in human made disasters, there are also certain disasters or an emergencies which are caused due to human negligence, like our Bhopal gas tragedy in 1984, which was essentially actually malfunctioning of valve, which was actually not properly under maintenance or not nor identified by the workers or the specialists there. So these are all actually that due to human error, and some of the things are due to human intention also. Intentionally, actually, people actually don't close the valve, or intentionally actually to create a larger disaster, larger emergencies. They go on sabotage, put actually some nuclear device in that, like dirty bomb, which they must have spoken to you. So these are all actually that human made disasters. CBRN actually exactly fits into human made disasters. So what is that actually the psychological impact on both these disasters or both these events, emergencies? Of course, both the events will have a large amount of psychological impact, because it is just not about loss of life, loss of property or injury, or actually loss of livelihood, but it is also actually creates large amount of anxiety, panic among the people, among the community, among the families. So it actually shakes the system, shakes the structure, shakes your actually the way we live. So your equilibrium, actually you are actually fine today, everything is fine, you are there, you are actually, your day is set, you had your proper food on time, everything. But when a disaster comes, all these things actually gets disturbed. So your actually equilibrium actually goes for a toss, and there actually sets actually a large amount of psychological reactions due to actually changed way the surroundings, the situation and everything, and also the way actually that we are affected, which I'm coming about it later. So both that they place, both the disasters, absolutely there is actually an impact, but which one is actually greater? My point is here, who actually affects more, whether somebody is in the natural side or somebody is in human side, human made side. Natural side, of course, there is actually an impact, but people actually come back to their normalcy, or the recovery process is actually much better than people who encounter human-made disasters like CBR and emergencies, because in natural disasters and hazardous event, when a large amount of reason cause is attributed to the nature, attributed to the Almighty, or I mean attributed to something which is not in our control. So the movement actually they actually accept this I mean component, then हिंदी में एक्चुअली बोलते हैं स्वीकार कर लेते हैं, ये हमारे हाथ में नहीं है, ये ऊपर वाला का हाथ में है, और हमारा हाथ का नहीं है, ये एक्चुअली प्रतिक्रिया की वजह से एक्चुअली होता है. So it's due to nature, it is due to so the moment you start actually having this sort of an understanding, you are able to actually recover much faster, because in these sort of a things you are going to get large amount of support from various sectors, various departments. So much of things actually going to be coming in a multidimensional mode, and so that is where actually that the recovery is also actually much better than the human made disasters. Human made disasters psychological impact is going to be long lasting, it is going to be much more chronic, it is going to be much more severe when compared to the natural hazards, because as I told you in the beginning, there will be an human intention or human intent to create actually horror, terror, insecurity, fear among the community, individual, or a group against another group. So that is why people who encounter riots, war, CBR, and emergencies are going to face large amount of actually psychological stress. For example, I would like to quote our own 1984 disaster, Bhopal gas tragedy, and even ICMR, actually Indian Council of Medical Research, has been following up with the survivors and the communities, and they have done periodic evidence-based research on their health and mental health. And it also states that even after 30 years, still this population is actually suffering highest form of psychological stress along with the physical ailments. So this is what actually that our own examples from our own country says, and across the world also actually that this has been actually corroborated, the various events and incidents which happened right across from USSR, former USSR, to Japan, to and other places. Next. Next. So, response to disasters. So, I'm still talking about disasters. See, I mean, how this psychological impact is determined. It determined because of various factors in our society, our living condition, and the basic demographic aspects of the individual or the family or the group or the community, that actually makes the difference. First and foremost, CBR and emergencies, the magnitude of the disaster. How big is the disaster? How big is the emergency? That much is actually going to be the stress level. And also the occurrence. CBR and emergencies, you can't predict it actually, that it is not actually going to come like cyclone is moving, cyclone is means standard, that high pressure, low pressure is coming. People can predict it how much fast it's moving. But CBR and emergencies can happen anywhere or anytime. So it's a occurrence. So this is also actually contributes to your psychological stress and the suddenness, which I told you already, the occurrence and the suddenness and the type. The bigger the emergency, the higher the stress level. And also, people who are exposed to these CBR and emergencies also actually matters, because the highest kind of stress you can see among the children, the vulnerable groups like women, the elderly, the disabled people with disabilities. So they will be actually having more psychological stress, because their innate actually inability to actually of certain things in their own life already were predisposed to actually certain limitations, certain difficulties. So that also actually contributes to the way they respond, the way they actually face these challenges, and the way they assimilate this stress. So those things actually, so they will have a large amount of stress. And also the personality, the coping skills. Some of the people, for example, in Fukushima in Japan, we saw a nuclear emergency, because tsunami came, then earthquake, tsunami came, and then the nuclear power plant got damaged. and there were radiation. So, but still, Japanese people are actually one of the most prepared people in the world, in the globe, in terms of disaster management or disaster preparedness. So they have an equipment, they have skill, they have a knowledge, they have a training. But in spite of all those things, the whole community in this Fukushima had to undergo severe form of a stress. But when compared to the other communities, we would say actually that some of the studies say that they know it, they already know it, how to actually handle these sort of things. So that is where actually the coping skills and the previous past experiences also actually matters. How the community is prepared and the kind of leadership and the kind of experiences. So all those things actually influences. For example, God forbid it doesn't happen in our country or anywhere. If that happens, how many of us are actually trained? How many of us are aware about these aspects? What is the CBR? Even actually for the professionals, even for highly educated people may not be knowing CBRN. Even for my say, I mean, in my own experience, having put 24 years in disaster management, among the disaster management professionals, many of them actually don't know what is CBRN, how it actually impacts, what is its signs and symptoms, where to go and get the help, what sort of a help. So this has actually been actually a perennial sort of a problem actually that even the professional don't know, leave alone actually the common man. Then next. So CBR and emergencies became a reality. Today I'm talking to you about CBR and emergencies. When I was in school, I used to see Star Wars movies. And we never thought actually that one day we are going to actually talk about the same sort of a some laser, some radiation, and all those things, and CBR and emergencies. We used to watch in some of the English Hollywood movies, but today the CBRN has become a reality. There has been events, incidents happened all over the world. So it is actually essentially an terror aspect also. People who create massive public anxiety through CBRN. So, quite essentially, this is actually a psychosocial, psychological warfare, they call it. So, dirty bomb and all, actually, that my colleagues would have spoken to, or they will be talking to you. So, this is where actually that CBRN emergencies today become relevant. And I'm talking to you in front of, I mean, I'm talking about all those things. And today, different parts of the country, various people are talking about the importance of CBR and emergencies for different stakeholders. Next. Next. So I will not go into details about CBR and emergencies since you must have had this class. The issue is that, of course, today, as I told you, it has been all the four things are actually happening across the world, across the globe. In India, also, some of the incidents happened, notably the chemical and even the biohazard. Recently, all of us have experienced it, encountered it, some were affected by COVID-19. So these are all actually some of the things actually which is actually throwing a challenge to us. So it is for us to actually not only knowing about these emergencies or incidents, we should also know actually that what are all the factors are there inside, how it actually affects our own daily life, or it is our, I mean, our community, how it actually, what are the repercussions on our health and mental health. Next. So, CBR and emergencies, absolutely, actually, it is a very, very stressful thing for anybody. One of the important tasks, what are all the things actually happens? For example, if there is a radiation leak, if there is actually a disaster happens, if a chemical leak, a chlorine, we keep hearing about chlorine leak, or actually something that MIC, methyl isocyanate, which actually was the cause for the 1984 disaster. So what is that actually happens here? Or even in COVID-19, what is that actually happens? So one of the important aspect is that first and foremost, shock, numbness, denial, actually that. These are all in the acute phase immediately. COVID actually 19, when we got positive, we thought how it can come to you. I mean, come to us. How did it happen? I was protecting myself. I was not moving with anybody, not talking to anybody. I was actually isolating myself. Still, I got it. I'm actually hale and healthy. So these are all some of the initial sort of actually reactions one can find, and then fear and anxiety. So large amount of anxiety is there. If it comes, what will happen to me? Or whether if I got contaminated, what will happen to me? Whether my skin, I'm having some skin rashes or skin itching. So what will happen to me? So these are all some of the things. See, one of the example I would like to quote from my own experience back in Delhi, when there was actually a radiation object was found in one cupboard shop. I mean, that is actually kebab shop in Delhi. And the people who actually handled it, and they were all detected later, one person died. And that actually brought out large amount of anxiety among the community, among the shopkeepers, whether I will get it, I mean, whether what will happen to me, whether I'll get a cancer or whether I'll get some other genetic disorder. So these sort of things are actually very, very palpable in these sort of incidents. And also guilt, either at surviving or believing in one did not do one's best to help others. This is a guilt means survivor's guilt. This which we commonly seen during the COVID, that what happened was that I shouldn't have left my parents to go into that crowd. Because of that, he got contaminated and he died. I shouldn't have actually put my children in that school, or I shouldn't have actually sent my student to, I mean, children to class, or I shouldn't have actually sent my wife to go and get some material from the market. Because of that, she got infected and then she died. So these are all survival guilt, actually, that this is actually going to be on a long term basis. And also, there will be actually helplessness, hopelessness among the people. In COVID 19, we saw actually that we are not able to go out, we are not able to interact with anybody, we are not able to actually go and get some help from the health side, or oxygen cylinder, or a bed, or even actually a vaccination. So we felt very helpless, hopeless also, actually, many times, because we were isolated. So, and also anger may be, I mean, anger will be actually one of the important aspect during these sort of an emergencies, that why this should happen to me. Many people said what I have done. I lost my father, I lost my mother, I lost my brother, I lost my kid, and many incidents actually happened. So the same thing actually also applies to other disasters also. These are all some of the hallmarks of actually the emotional reactions in the CBR and emergencies. Next. So, so what are all the previous slide? I think you jumped one slide, I think. Previous slide. Next. Done. So, what are the other aspects? This disassociation and confusion. CBR and disasters are not like our floods and earthquake or something. You can see it and feel it and all those things. CBR and disasters can't be seen, can't be felt, can't be actually smelt. So there is no color, there is no noise, there is no actually smell. So this is actually very, very difficult to detect by your five senses. So that is where actually that it is going to create confusion. What happened in 1984? Well, people just falling and dying. People could not understand what was happening because they were inhaling the gas. MIC. So same thing actually happened in during this Mumbai chlorine leak also. So people were actually started vomiting, people started fainting. So it will be very, very confusion actually in CBR and disasters, like unlike other disasters. And there is also going to be large amount of intrusive thoughts, images, memories. People who got affected by these sort of an events will repeatedly have like a night, like a replay, like a TV replay, match replay. They do it, no? So again, the thoughts will come again, that images. in front of me they were actually falling and dying, in front of they were actually holding their chest and falling. So these sort of memories will keep actually haunting. And also hypervigilance, this is actually that hypervigilance due to exaggerated sense of risk. Once you are anxious, once you are actually not knowing what to do, so again, even a small sound can actually make you jump, and you are not sleeping. They will not be able to always hyper, they will not be in a relaxed, rested mode. Always actually, even a small sound can be, they will awake. So, which we all do it actually in our day-to-day life. But here actually in CBR and emergencies, this is going to be mostly common, and also impaired memory and concentration. Because in CBR and emergencies, you are not actually inhaling a normal sort of an oxygen, I mean, normal sort of air or something. You may be actually inhaling contaminated air, you may be actually inhaling the toxic poisonous gas. So definitely actually that the memory, there will be actually cognitive damage, the decline, the memory and concentration, you cannot focus, or you will be, as I told you, actually confusion, everything. And also actually that somatic complaints, because CBRN is actually you can't see, you can't feel, you can't touch. So all these things are there. So you there is going to be actually one major aspect is that psychosomatic complaints. That means that you will have a unexplained bodily symptoms like a lot of kamar dard ho raha, sar dard ho raha hai, or body pain ho raha hai, or bechani lag raha hai. So all those things actually that these are all actually that physical attributions of a psychological impact, I mean, trauma. So this is where actually that the individual reactions to CBR and emergencies are the cognitive load. Next. So usually in a CBR and emergencies, what people do, I think you jumped one slide. Ah. So withdrawal, first and foremost, people will not go and talk. People will keep themselves. So withdrawal from actually the interactions, irritability. This will be very very common, and that will be very very destructive. Even we saw in COVID-19, there were large amount of family issues I mean, cropped up because people started living in the same place for longer period of a time, and that actually also got into some interactions, irritability, and all those things. Loss of trust in others. Actually, the CVR in emergencies is an emergency. You can't trust actually that. COVID-19, did we have this? We were actually, if somebody is actually having a sneezing, or somebody is actually having a running nose, we actually was fearful of going near to them. Or even if somebody sneezes, we actually started actually going away from them. So there is a loss of trust. So this is all CBR and emergency, very very common. And avoidant behaviors of people started actually avoid going to certain places, certain objects, people actually because trauma, because many people actually stopped going to hospital post COVID near actually the emergencies, or many people stopped flying, many people actually stopped traveling. So all these things actually very very common in CBR and emergencies. So this actually happens at a social front. So your interaction pattern, you are interacting with the outside of your own, this one actually comes to actually a toss. Next. So these reactions, what are all the reactions? Distress reactions, which I almost spoke. So definitely, this is going to have a large amount of impact on your health and mental health. There will be sleep disturbance. There will be actually disturbance in your basic functions, that is appetite, sleep, appetite, and other biological functions. Along with that, actually, that you will also actually have anxiety, depression, PTSD, and complex. See, these are all actually diagnosable sort of issues. What I was talking about, all reactions, but those reactions persist from a point to point. For example, if these symptoms and reactions, if it is there in the first week, second week it is okay. Anybody actually who undergoes such a incidents or such a trauma tend to actually have all the sort of a reactions and something. But if somebody is having these reactions even after 2 months, 2 weeks to 2 months, then definitely actually that this person actually requires higher sort of a psychological care, because that needs to be clinically evaluated, assessed, evaluated, and diagnosed, and put on the treatment, psychological treatment, right? So, so these things are actually only handled by professionals, mental health professionals. And also actually that there is the CBR and emergencies disasters also brings in large amount of behavioral changes, like people actually who are not able to withstand these sort of a trauma or difficulties, challenges, started actually smoking, or actually they increase their smoking, or they started taking alcohol, or they will increase their intake of alcohol. So one of the important aspects, studies all across the world, and our own experiences shows that even in COVID-19, there is actually a manifold increase in substance intake, both alcohol or tobacco or cigarette or anything actually that. So this is actually one of the thing, and also uh, social networks. So we are actually not, there is actually a restriction in the social networks, not on this mobile phone. Here we are always connected with the Facebook, Instagram, so many things. But the social network outside, I mean, with our relatives, with our dear and near ones, or with our neighbors. So there actually that there is actually a reduction in the, network, social networking. So this is also actually one of the impact of CBR and disasters. Next. So, what happens in a CBR and disasters? So, any sort of a CBR and emergencies, first and foremost, we will not be clear about what is happening there. It may take hours and even days, because you have to bring in just not actually one policeman or somebody from a revenue department to handle a disaster management, or some volunteer from an NGO. But here you need to bring in some specialist from some chemical organization. For radiology, nuclear, you have to bring in specialists from BARC, or somebody. So you need actually some specialist to actually come and diagnose it, assess it, evaluate it, and tell what is this and what extent actually it affected, and what is the way to actually come out of it. So till that time, actually, that you will be actually under severe stress. So you don't know what to do. So that is where actually that it actually much debilitating in CBR and disasters. And also actually that some of this you can't see actually those many things. Like for example, did we see actually COVID-19 in our eyes? No. Damage was going on, damage was done, but it actually we could see only the consequences, that we started falling sick, we started actually having high fever, we started having severe pain or lethargy. So all these things actually later on, so that actually increases the psychological stress. And also many times actually that the impact of assessment, unlike cyclone or floods, we can't do it here by our own self. So that is where actually that it is a technological disaster, and we don't have actually skills and knowledge to handle this. Next. So I already told about all those things. So I will not delve into too much into it. And one of the thing here I would like to actually pinpoint in that slide is that, see, in CBR and emergencies, you will have actually one group of people who are called worried well. For example, this is actually 60 to 80 percentage of the people may be actually having these sort of things in our previous experiences or across the globe. In most of the CBR and emergencies, we used to see actually that large amount of worried well. They will also have same sort of symptoms, but that will be pseudo symptoms. They will feel that they may be having that sort of a symptoms. For example, in many of the incidents, they said, I also feel like vomiting, I also feel like puking, I also having body ache. I am also actually having a headache. But that actually symptoms are actually not very clear. They perceive that they may be having it, but they may not be having that. So when we screen this, they may not be having anything. But just for the sake actually that rule out, we have to do it. But a country like India, how many people we can actually go and do assessment and rule out these things? The 19 in Japan, there was actually a chemical attack in a tube. Tube means the metro, their underground metro. So in that 279, I mean nine hospitals in Japan flooded with these sort of worried well people. Everybody started throwing symptoms. So that is where actually that CBRN is a very very challenging emergency. So all the people who are actually in that vicinity or somewhere in the periphery or in the actually got affected will have large amount of these sort of symptoms, but may not be a real symptoms. So for the health care providers, first responders, that is actually what the challenge, and it's going to be very very difficult to actually identify and segregate them. So it takes large amount of resources, time, and equipment. So we don't have those things, luxury in those things. Next. Yeah. So this is actually again what happens on the psychological front. Mm, so first and foremost, why this stress is high, other than you are getting affected by the substance or radiation or a chemical or anything. First and foremost, your routine actually goes for a toss. You cannot actually function like anybody else. You will be quarantined. You will be isolated. And also actually you need a large amount of equipment to actually even protect yourself. Like in COVID-19 we saw we needed the mask, we need a full gown in the initial days, shoes and everything, and then your tablets, then your food. I mean, so many specialist things you are. So absolutely this is all actually, other than the distress of experiencing it, affected by it, these things also actually going to actually increase your stress. And also actually that unpredictable behavior. So you have to actually, the people also will be very very unpredictable, these things. So they may be agitated, they may be angry, they may be criticizing, they want first care when compared to others. So there is actually always actually a disharmony also actually it creates among the people. And also that uh, in these sort of a things, you can't actually communicate properly. So you saw actually that we were communicating to the phone during the COVID-19, but we will not be able to actually communicate properly because we were wearing a mask, we were wearing this, everything. So in other emergencies, even much more dangerous actually that, because you have to wear a bigger mask, chemical and all, you can't inhale any those sort of a poisonous gas. So definitely actually that after 45 minutes or something, it's very, very difficult for a country like India to actually handle those personal protective equipment and work or communicate. Next. This itself will create more stress. So I can actually take some of the questions regarding this. Just I understand actually that in India also these sort of incidents actually keeps happening, and people are getting affected both physically and mental health wise also. Next, next. Yeah. So, as I already mentioned, this Bhopal tragedy, and these are all some of the statistics in prevalence, this one on various studies. So, if you look at it, actually, that even after 3 decades, second generation is third generation must have come. Still, actually, that it is not only the people who are affected in that time, 1984, even the subsequent generations also actually had some form of actually difficulties on health and mental health front. Next. So, what is that actually that these disasters doesn't only teach us actually our vulnerability, our risk, but it also actually teaches us actually that what is the way forward, how we were and what we have to do it. So first and foremost is that on a psychological front, At that point of a time, there were only one psychiatrist was available in Bhopal, whereas many mental health professionals went from UP to actually provide psychological care. And even Bangalore, my teachers actually also went that time, actually provide care. Then they found actually that if the local resources is not there, then we need to actually train non-mental health professionals. It means people who are in the health field, people who are actually as working as a doctor or an allied health professional like ANMs, like staff nurse. So these people needs to be actually trained on providing basic sort of a psychological support, so that the bigger actually issues of psychological issues can be handled by specialists, because very few people are there mental health specialists still now also, that time also, now also. So that is where actually that these lessons actually 1984 actually came, other than the impact. Next. So, which I'm talking about COVID-19 very often, because we can actually easily understand and relate, because we are just fresh from COVID-19. All of us actually had some form of impact. So that's where actually that this is actually, it actually have a larger implication on psychological health of people. Next. So I will not talk much about all those things because my other colleagues from biological emergencies will handle these things. Next. So COVID-19 is not new to us, or any this influenza virus. All these things are not new to us. It is there always with us, every day, every life. And the biggest was in 1918, like our COVID-19, and which saw actually that you see 7 million people actually that. So it was huge actually that. But recently also we saw 2003 SARS outbreak. Then in 2019 that swine flu, everybody was talking about swine flu and things. So these are all actually keeps happening. But recent big one was 19 COVID-19 next. So, which I already told you actually that. Next. So, what are all the impact of biological emergencies? You saw actually that first time in our own life, we experienced quarantine. What is the duration? I mean, quarantine is actually only we used to see for very highly contaminable diseases, but not for actually commonly a whole society, whole neighborhood, whole district, whole nation, whole state was put under quarantine, which we saw recently. So that also actually brought out actually many psychological issues, like feeling of loneliness, feeling of alone, and feeling of frustration, feeling of anger, feeling of helplessness, hopelessness, all those things actually that which the longer quarantine duration actually brought out. And the fear of infection was very common, as I told you, frustration. And one of the important aspect was during this COVID 20 to 22, especially the first year, the boredom actually, that we were all actually holed up inside the house, not going out, not able to work, not able to actually interact, not able to play, not able to walk, not able to jog. So many things actually that it brought a drastic actually change in our day-to-day life. And that boredom also actually one of the psychological impact. And you saw that inadequate supply of not only the medical supplies, but also actually food and other essential items, and inadequate information. Many times we were not knowing what will happen, when will happen, who is going to give vaccine. So the biggest dilemma or a distress was about inadequate information. We used to run a COVID helpline here in this place. It is in 13 Indian languages, essentially to provide psychological care during the COVID-19. Most of the calls after 2021 were about actually the vaccine, where we will get the vaccine, how we will get, whether because of this vaccine, whether I mean, anybody will have any side effect. It will affect their brain, or it will affect their other body functions, or actually their life. So these were all actually some of the things which was very very common. And one important aspect during this biological disasters emergencies, financial loss and stigma. You saw many national news channels were talking about like first responders were not allowed to go inside the society or inside the apartment. People don't want us to actually go inside. All of us actually experienced it, especially people who worked in the health sector or the first responders, carrying that stigma. And also financial loss, because many people lost livelihood. And you saw actually that cutting across the nation, one scene was actually scenario was very very common, was the migrants actually, especially here, people who have come from northern India or working in South India in large numbers, who had to actually go back. Most of the train stations, and some of them actually went by road, some of them walked. So all sort of a things actually that we could see it. And also confusion, anger, which I already spoke about it, was very very common. Next. So the impact was very much not only in COVID-19, in other biological emergencies also, of people who are quarantined. For example, a developed country like Toronto, Canada, you see actually that there is actually a post-traumatic stress among the people, and depressive symptoms among the people who are actually affected by SARS epidemic. And also same thing is that 50% of the family members had psychological problem. It is just not the people who are affected, but also the family members. The same actually happened in our own country also. And my son is actually quarantined, my daughter is quarantined, my father is quarantined. I'm not able to meet him. I don't know what is happening to him. I'm not able to talk to him. And he went, his condition actually deteriorated. So there is a large amount of psychological stress for the family members also. Next. This is actually about the COVID, which actually showing some important impact things. So this you can understand actually that how actually the impact actually among the people went on in India and other place. Next, next. So, look at actually the Indian aspect of COVID-19. Among the studies, sadness was very, very common among 30.7 percentage of people. Anxiety was 36 percentage. Irritability, frustration, and look at actually that use of social media, because you are not interacting, you are not going out. Everybody was into mobile phones, YouTubes. In one way, it helped them. In other way, it actually also got a lot of other issues. For example, we used to see people who are not able to sleep because full night I used to see YouTube. I only sleep in the morning, so my routine changed, and my eyes are burning, and I'm not able to focus, my head is spinning. So all this sort of a things actually that which came up actually increase in negative emotions. All these things actually will increase your negative not positive things. Next. So the pandemic and the so psychosocial concerns. What are all the concerns? So these are all some of the concerns actually that absolutely their plan life of getting married or going for abroad for a job, or actually going giving an exam, studying this, or going to some place. So everywhere actually there is a discipline getting operated. So a lot of other aspects also actually which contributed. So this increased family issues, individual issues, community issues, and also actually large amount of created a distance. There is a gap actually came on various spheres of our life. Next. So some of these disasters also actually brought in more psychological stress. That is, one is health workers, first responders, and migrant workers, whom I already mentioned. Women survivors of violence. See, one of the data which is showing National Commission for Women and the National Crime Records Bureau report that there was a multiple level of increase in terms of actually domestic violence because people were at home, people were not working, and there were actually loss of livelihood, and the intimacy where they were closely staying there. But that also created large amount of this one because people are also taking increased alcohol. So these are all actually interrelated issues. There is one issue is interrelated to others. So that is also there. People with period mental health vulnerabilities. For example, before COVID, there were many mentally ill persons taking care. So there was actually a stoppage in their treatment. So they got relapsed. So there is a many relapse cases. So they went back actually to their pre-illness, the illness days. So that is also actually one of the major area of concern which we had to address. And also one important group which I would like to mention here is the LGBT community. So this is actually already a marginalized group who is not actually mingling like any other community. But COVID-19 even segregated them. So they went into actually even highest form of stress. But I don't have a data to actually show it. But this has been there actually across the world. It is understandable also. Next. So this is actually across places actually that how this got affected. So everywhere which I already mentioned about all those things, first health workers are actually most prominently affected in any country, not only in India, in other places also. Next, next, next. It will be boring actually that by 3 o'clock to 4 o'clock is not a good time, but still we have to actually. But you can shoot us some questions to me at the end of this presentation. And right, next. Uh, for us, the health professionals who are first responders, of course, actually that it was very difficult. Changes in the work routine. Many of us actually could not go back home. We have to stay back and work continuously for weeks, months. Workload was actually enormous. Erratic work training, I mean, timing also. It was not actually scheduled. So challenges with working with this personal protective gear was not at all actually pleasant. And a country like India with it is such a hot place, so absolutely very distressing. I mean, and fear of infection also, and stigma and rejection from the society. Many of us actually could not go back home because nobody wants us. Surrounding people doesn't want us because we may actually infect their households. So this was actually one of the case which I handled. So he was actually talking about all those things. You can read it. So very distressing for even people like first responders or healthcare professionals. Next. So also one major this one is that separation from our own families, and we could not actually have time with the family, and so we ourselves felt actually that by going they should not get infected, or I should not pass on to my aged parents. Even myself actually that I did not go home to see my two aged parents. So and many times actually that we have to conceal actually that because they will get anxious that we are not working on it, we are safe, we are outside, so something like that. So this is actually cutting across the places actually that we could see that. Next. So I mean other things actually that we could see actually that, but there were actually also actually large amount of family support, peer support, and we have to listen to music, positively actually how we can actually cope, indulging in some of the very positive coping rather than actually going and smoking or drinking or actually so we had to take a lot of rest and we have to actually eat good healthy food. So these are all some of the actually positive healthy coping actually that first responders or healthcare professionals were doing it. Next. So what exactly we have done in COVID-19? So a lot of preventive strategies like what to do, what not to do, do's and don'ts, and training and learning approach, how to actually handle these sort of situations. And we had to actually practice certain standards, actually SOPs and all, to do that, and also surveillance network. So we had to put in actually surveillance network actually that where actually the what is the status to have a constant update about actually that, and also self assessment. We had to actually put self assessment also. What are we doing? And how are we doing? So whether actually is there any reduction, decrease in any of our biological functions or do we have any symptoms or screening protocols. There were actually also screening protocols and rehabilitation, and also actually that we had to actually talk about lot of peer support programs. So these are all some of the things actually that uh, doing it, and essentially these programs are all prevention and promotion strategies. For example, how to prevent these sort of things, how to protect ourselves if we have it, how to mitigate this. So this is what actually exactly we're focusing on that next. So this is actually radius. I spoke about biological. Now the radiology is very very challenging. I'm sure actually that Dr. Mishra and others would have actually enlightened you or elaborately. Here, the issue is that it actually brings in a large amount of health risks, especially for the popular, I mean, vulnerable population. So that actually also increases their stress level. Next, it changed, no? Next. Yeah. So what actually happens in a radiological or radiation emergencies? See, this is actually one thing Dr. Mishra must have spoken to you. Same thing, our Mayapuri. Right side is our Mayapuri picture, and the left side is actually that Italy. Sorry, Brazil. Both are similar. Both are actually some radiation source from an education institute landed in a common place, scrap place, and that people were came into contact, and then there was actually large amount of panic. So within a short period span of time, the immediate geographical area or a perimeter, they had to actually screen everyone present there. So mostly actually there was actually a large amount of anxiety, panic, fear was there. So this is actually the hallmark of radiation thing. And no local person, hospital person, even in Delhi, I was there that time in Delhi, the local hospitals, none of the hospitals actually could identify. I mean, at the end of the day, an army referral hospital only could identify because they are already training. Having army is actually already having this knowledge, skill, training. But whereas civilian hospitals could not identify what is EBR and why this person is actually having a burns. So whether it is a normal sort of a burns, but it was not a normal sort of a burns. It was a radiation. This one. So that's where actually that challenge actually transforms into psychological disorder, distress. Next. Here also the same thing. See, the symptoms, reactions, and all commonly actually it is coming across the domain, whether it is biological, whether it is chemical. So everywhere actually that the same thing happens. So here also the same aspects which is coming. So it is equally actually very very debilitating for anybody actually who actually encounters this the radiation emergencies. Next. So what happens? So future is uncertain because radiation about residence. So probably you will not be able to be in the same place, same work, same this one. Once you are actually exposed to radiation, definitely they will take you and put you inside quarantine, and you have to actually undergo a large amount of stress and tests. So it is actually going to be actually a big social prejudice stigma on you. So people, unless you get a green signal, you people will not come near to you, or you will not be able to go near to people. So large amount of stress actually comes from that. For example, when we visit a nuclear plants, so once we visit, when you're coming back, you have to cross through multiple layers of checks. So if is there any beep comes red color, you can't actually move out of that place because radiation contamination. So you have to actually clear it off. You have to undergo various procedures. So it's a very, very cumbersome sort of a process. So definitely, actually, it is going to be actually very, very stressful for anybody. And here also actually that you can't predict. So definitely, actually, that there is actually going to be increase in these sort of disasters, because today these radiation devices are easily available in market, or one can actually try to do sabotage, do all those sort of things. So that is where actually that you need to be actually careful. You need to know about these things. You may not be handling everything, but at least you should have a basic knowledge about these aspects. Next. So major nuclear incidents happened across the world. First is actually that very most notable was Chernobyl, the former USSR. Presently, it is in Ukraine. So that was actually that you know what happened. That if you are not knowing about it, kindly go to Google. It will help you actually to handle. But the large amount of that place is actually today is a ghost town, ghost city, Ukraine. This Chernobyl. So right from plant to everything has actually been because of the radiation, which was actually felt across the continents, across the globe. So that is where actually that the impact of nuclear emergencies. Next. So I already mentioned about Fukushima. Definitely, everyone got affected. One of the important aspect is that here also stigma. See, the stigma comes is actually that people refuse to actually even take your products. For example, in Fukushima, uh, farmers, some of the actually people who are selling milk, some of the people who are selling spinach. So all those things are actually there. They don't want to buy from anybody from this sort of a this one. So it is just not about the impact of the disasters. The post-disaster consequences also actually creates, uh, I mean, enormous amount of stress. So your confidence level goes. You don't want. You are rejected. You are actually isolated. So all these things actually that comes with the certainty and uncertainty about their day-to-day living. So this is actually which we saw back in Fukushima. Next. So this actually I spoke to you, Chernobyl. It actually affected every form of a life, every form of a living organism, every form of actually an entire environment, ecology, everything. So that is where actually that it is still date actually one of the worst incident of nuclear disasters in our earth. Next. So this is not much actually. I mean, you can actually see this PPT, and there was actually a large amount of mental health issues, mental illness actually came out after the Chernobyl. Next. Worried, well, I already told you. I need not repeat. So every CBR and emergencies, you will find these people more. Next. So this is already covered actually that. Next. So how we can actually handle this worried well? First and foremost is that you have to provide accurate and timely information. Second is that you need to actually respect actually the people's reactions, reason out. So even unaffected people can actually, reach you for this one. So you need to be patient in providing actually the authentic information, and you have to actually understand and segregate. And two different set of people will be there, and also actually that so you need to actually triage. There is where actually that we call it triage. Whether you are actually from the ground zero or you are staying in the nearby village, all needs to be actually provided with care on priority. That who is requiring what and how much is actually they are requiring. So that is where actually that important. So you need to actually grade actually that triage will grade who requires immediately. For example, children, women, elderly will require immediate. So like that actually that you need to grade this population. Next. So finally, actually, that coming to us, as I already told you about these things, caregivers are actually one of the most affected. They will have all sort of symptoms like rapid heart rate, headache, nausea, inability to relax because they have to keep working on, and there will be actually trouble in sleep aspects, and also actually they will be actually storing, taking large amount of negative feelings from others, and then later on actually that these all piling up inside, and definitely actually that it is going to actually one day it's going to actually create havoc on them. So they will have difficulty in thinking and even problem solving. So there is actually going to be a large amount of issues among people who help these sort of people affected by CBR and emergencies. Next. So other than that, their own impact, definitely the resource limitations, because they have to function long hours with less resources, and also actually that stress and strain of actually always seeing these people, their own actually health affected. So all these things actually create havoc in their mental health aspects. Next. Hmm. So So I already told you about it. I think I can take some questions regarding it. So they will also have all sort of issues, like what I was talking about. So it's actually important for us to actually to provide care to the first responders also. Next. So first and foremost, how we can actually help them to take care. First and foremost, help them to actually retain or maintain or actually come back to their routines. So routines gets affected in terms of sleep, in terms of food. So there only actually we have to be emphasizing them actually to first and foremost to eat properly, sleep properly, or maintain that actually both actually together. So this will actually help actually in a great extent actually that how we can actually they can see their stress. Next. So again, actually, that there are various stress management categories, strategies are there. I can't actually pinpoint one, but all these things actually that they need to actually inculcate, whether it is inculcate, even whether it is individual level, family level, work level, spiritual level. So they need to actually start actually doing more things, more active. I mean, looking into positive coping, like no, I mean, positive coping is sleeping on time, eating nourished food, interacting with their dear and near ones, taking care of their families, and doing exercise. So these are all positive copings. So they have to be actually encouraged for this, and they should be discouraged for taking alcohol, taking smoking, taking tobacco, or watching YouTube full night, or actually getting up in the morning at 4 o'clock and watching YouTube. So these sort of a we need to be actually teaching them to avoid. Next. So same thing actually that this is what actually mentioned elaborately. So we need to bring in an healthy sort of a living among the caregivers through these sort of a strategies. Next. So same actually that not much of a things. It is individual level, family level, community level. I will not go into the details. It is very, very self-explanatory. And you can actually ask some questions regarding caregivers, self-care, like people like us. Next. So in conclusion, CBR and emergencies are very, very a reality important in today's the changing disaster management scenario. People are actually, countries are actually growing manifold. We are actually moving towards new technology and industrialization. And all these four things are actually inevitable in many sense for many of us, for many of our states. So we need to understand, have a basic knowledge about CBRN so that we can actually handle it in much better way. Thank you so much for your patience, and I'm ready to take some of your clarifications and questions. Thank you. I know that it's a very long session, but I could actually bring out some of my experiences working here. So, any other things? So, if there are no questions, we can wind up, Mr. Manoj.
Yes, sir.
Thank you so much, and thank you all participants, my dear friends. Thank you for your patience, and I'm sure actually that at least some of you got benefited. And if you have any queries or if you have any help, you are most welcome actually to connect with me. It is there in the website, Niman's website, this department, my name. You're most welcome anytime. Thank you very much. Have a good evening and a safe, healthy, happy life. Thank you.